The Health and Social Welfare Minister, Professor Mohammed Ali Pate, stated that the federal government is working diligently to address funding and policy gaps in the healthcare sector, particularly following the U.S. court in aid funding during an interactive session with the House Committee on AIDS, Tuberculosis and Malaria.
It's a responsibility of the federal government, it's a responsibility of all state governments, and is also the responsibility of local governments. There is no level of government that is absolved of responsibility in contributing to health. On the federal government side, we have corralled, we have signed compact, and we're working hand in hand with states and local governments. But the resources that the federal government is investing is not the it's not the totality. All levels of government, whether it's on malaria or HIV or TB or infectious disease or primary health care, all levels of government have to pull their weights so that we achieve. So just as you are focusing on this at the federal legislature, I also urge our state houses of assemblies and our elected local government levels to weigh in, because it's the three levels of government that will make this health system be transformed.
The U.S. decision to cut aid funding to Nigeria was sudden but not significant due to federal government policies and interventions. Collaboration between the federal, state and local government on healthcare programs are started yielding results as the committee aims to ensure seamless implementation of HIV, AIDS, tuberculosis, leprosy and malaria programs.
Nature of it, I think Nigerians can be rest assured that government is doing all that it can within its limited resources to ensure that we provide for the treatment of our population this year and also in the years to come. In terms of buying the commodities, bringing them in and distributing them. It may not be the same level as those who were bringing it through the external parties who were doing it. They were bringing those resources from paying in US dollars. We have Naira. So we have to calibrate the expectation, but President Tinubu and his administration are doing everything possible to ensure that we protect the health and well-being of Nigerians. And the impact of the shift in U.S. policy is not one that we would allow within the limits of what we have to undermine the health of Nigerians.
It is important that the House Committee on ATM be on the same page with the minister and the ministry. This will ensure that programs and projects relating to the HIV/AIDS, tuberculosis, leprosy, and malaria are implemented seamlessly without any bottlenecks, because they are critical to saving the lives of our people and Nigerians. My dear coordinating minister, we have always argued for increased domestic funding and less dependence on foreign funding for our health system, and as we are all aware of the withdrawal of financial support by the U.S. government's funding for African health system.
Mr. Oga advocated for the establishment of a healthcare sector trust fund to address funding gaps and potential issues during an interactive session with journalists.
Hello, hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.